CAP is a physician hospital organization, also people will refer to it as a PHO, that is a coming together of the hospital and the physicians in our community.
Cuyahoga Area Physicians Alliance, or CAP Alliance, is the physicians arm of the clinically integrated network known as CAP. So we are partners with the hospital, Cuyahoga Medical Center.
It's 50% owned by the hospital, 50% owned by the physicians. And it's an organization that was really established to have that collaborative effort between the medical physician community and the hospital community around looking at how do we improve the quality of care for our community and how do we improve the cost efficiency of care for our community.
CAP Alliance has been in existence for 20 or more years, and working collaboratively with the hospital has really opened up kind of a whole new era of physician-hospital relations in this community. You really want to try to make sure that everyone is seeing things the same way as much as possible and pulling in the same directions. There's a major benefit for the physicians and the hospital to work together on issues. It certainly cuts down on a lot of waste, it cuts down on a lot of mistrust. Physicians aren't naturally trusting of administration or looking at medicine as a business. But what we've been able to do through the clinical integration effort is come together under quality metrics, trying to make sure that we're providing not only the best care that we possibly can, but care that's both accessible, affordable, and also excellent care. It's a way to feel like you're part of a general medical community that respects you, no matter what your position is, whether you're a primary care doc or a specialist. Everyone is equally important.
And for decades, it's been our experience here that by working together, we're able to achieve best medical care for our patients synergistically, with open and frank discussions between the hospital and our physician group.
More and more physicians have gone towards an employed or contracted model. And that's fine. I think that clinical integration is the instrument that allows a physician to choose the kind of model that he or she feels most comfortable working in.
We look at the CAP network, the Clinical Integration Network, as a bigger team, a team that's outside of our office, and so they're part of our team as well. So if you need to see a consultant, if you need surgery, if you need emergency care, we can use the other doctors in the area and use them as part of our team.
CAP is committed to improving the experience of our providers as well as our patients and providing cost-effective care that really improves the health of our population. Care management is an essential piece of that picture.
We really consider care management a service line. We're providing services not just to the physicians in the practices, but to the patients and to the community.
One of the things that we did with CAP was to ensure, especially when we moved into the clinical integration model, it's really around how do we have improved quality and cost for our employers and for all the patients in our community. And as the fourth largest employer in Tompkins County, we were viewing this not only as a benefit for the clinical care, but also for our employees as healthcare users in our community.
With care management, we have nurses assigned to each one of the practices within the network. And what those nurses do is work in collaboration with the primary care physicians to really help support the patients. Whenever possible, we meet the patients where they are. So whether that's in the hospital during an inpatient stay, in the ER, in the urgent care, at the physician's practice, and eventually even in their homes. So it's a real personal touch in order to provide the patients a bit of extra care and attention and support.
Care management also provides services to our providers. It allows them to identify potential gaps in care and to take action on them. It's very important that you have people who really understand the local environment, who are members themselves of our community, and who understand the needs of our patients making the outreach.
It's one of my favorite things to do from a professional standpoint is to talk about the medical staff at CAP with whom I have the privilege of practicing. We're a 204-bed community hospital. However, as surprising as it may be, in this community, in central New York, in Tompkins County, we really have a terrific medical staff. These physicians are almost to a T chief medical residents from at their training program. When I'm taking care of a patient, I'm able to focus on the cardiology portion, and I have full confidence and I feel genuinely happy that my patients will be well taken care of on their other organ systems and as a whole by the internist or family medicine specialist overseeing their care.
We have attracted a medical staff that I actually think is second to none. If you look at the CVs of a lot of our physicians, they could be chief of department at any tertiary care academic medical center in the country if they so choose. So why come to a smaller town like Ithaca?
One of the things I tell my patients constantly is that we're very lucky to have a facility and the medical staff that we do in a community like this.
So when we look at our primary care physicians, our specialty physicians, they're working much more collaboratively through the clinical integration model than they would if you were in a community with just independent physicians working independently.
And I think that's really important. That's something that you can't get in big academic centers. I've practiced there.
When you look at a place like Ithaca, about 100,000 people, depending on whether the colleges are in session or not. Doctors live here. We know each other, but we also know our patients. We also know our hospital peers because we live in the same town. We shop at the same supermarkets. We go to the same church events and school events. So it's working in a town like this is not like living in a major metropolitan city where you can get lost.
It's the level of care that you can get right here in town where your nurse may be going to school with your children, or their children are going to school with your children. These people care about you as much as they care for their own family.
I love the community. It's a very integrated community with lots of contact between the hospital and the administration. It was very easy to feel welcomed here and become a part of the bigger picture without feeling like you're isolated.
I trained largely in the Bronx, outside of Manhattan, and then moved south into the Upper East Side. And I always thought I wanted to be in the city, but I realized most of the time I spent there, I spent in Central Park. When I decided to practice, I decided just to move to the park.
I guess one thing I love it down here in Ithaca. I enjoy going to all the gorges. You'll find me oftentimes hiking or trail running on all the multiple trails and parks they have in Ithaca. And it's a great community to be a part of.
Ithaca is a great place. I think this wouldn't work quite as well without Ithaca because you're not really moving to a place that doesn't have a lot to offer. It's unique in that it's buoyed by the university and the two colleges, so there's a number of cultural opportunities that we honestly don't take full advantage of. We're surrounded by numerous parks, and we're in the Finger Lake region, numerous lakes. So in the summer we spend a lot of time outdoors at different farmers markets, going to the wineries and the breweries. There's actually endless festivals in Ithaca, which has been really wonderful. It's easy to take advantage of.
Our doctors are politically active, socially conscious, and again, working under the principles of clinical integration in partnership with the local hospital has given us an opportunity to feel like at the end of the day, we've really made a difference on behalf of our patients.
Ithaca welcomed us with open arms. We love it. Have a house, new settlement with our family. And it's really a place that we see ourselves in many years to come with all the opportunities CAP and the hospital provide for us.